please confirm if you can hear me? If okay, you were able to see my PowerPoint presentation. Can you please type yes? Type yes. I'm so sorry. I cannot see any comments right now. I don't know why. So maybe I am presenting my screen. Okay, so all right. Okay, can you please confirm if you were able to see my screen? Okay, type yes. Type yes. Okay, I cannot read chat. Okay, I'm so sorry. Okay, how about the others? Okay, can you see my screen? Can you please confirm, my dear nurses? Okay, because once full screen ko itong aking PowerPoint, hindi ko na siya makikita. Ayan. Okay, so I think everything is okay. All right, so I can now share my screen. Okay, so Miss Milanis, can you please confirm if you were able to see my screen po? Okay, so you can inform me if there is any problem when it comes to technical, no? All right, so okay, I cannot acknowledge. Okay, I cannot acknowledge you guys. Okay, so all right, so the chats are here. Okay, it's visible right now. So we have here, hi Victoria. We also have here, Arlene. All right, so hi. All right, okay, so it's visible. All right, so once I make it a full screen, hindi ko na makikita yung inyo pong mga names, all right? But I believe you're still, you're with me, right? Okay, so I would like to give a quick shout out for our dear nurses who are tuning in. We're live, okay, here in Facebook as well as in YouTube, right? Okay, so whether you're tuning in from the Philippines or in the US or somewhere else in the world, we're all here with the same goal, right? To help succeed in your NCLEX journey. So, let me know where you are. Okay, so just type in our chat box your location and I will acknowledge you guys later. All right, siga. Okay, so before anything else, I would like to formally introduce myself. Okay, so I will greet you again. Great day, good morning, good afternoon, and good evening. Good morning, great day. All right, para sa mga nasa ibang panig po ng mundo, no? So welcome to AM Healthcare. So today we're focusing on some of the hematologic disorders specifically for your anemias because we're just given like 30 minutes, no? Okay, so I chose this special topic, which is mastering hematologic disorders. All right, our focus is on anemias, right? So why? This one is a significant topic, all right, so with high probability for your NCLEX or in examinations, right? Okay, so I guess you're already familiar with this one. Okay, so you can call me Thin, and of course I am delighted to be here with you today. As you can see here, I have dedicated my career to the field of nursing with a particular focus on education and mentorship. So I hold Master of Arts in Nursing, major in Nursing Administration, all right, so from the University of the Philippines, and a Bachelor of Science in Nursing from Bulacan State University. I'm proud to have passed the NCLEX RN examination, stopping at 75 questions. So napaghahalata, no? It's very obvious because right now, okay, the minimum number of question is 85, no? Hindi naman, recent naman. Kakasing tanda lang tayo, no? And I hold nursing licenses in both the Philippines and in the United States, specifically in Illinois and New Mexico. So additionally, I am CGFNS certified, and I have successfully passed the Pearson Test of English, or the PTE academic. So with over 14 years of experience as an NCLEX RN lecturer and professor, I have had the privilege of training and mentoring many aspiring nurses. So my expertise spans nursing education, sales, leadership, and management, as well as utilization review and management po. So, I so chat, okay, the messages of our dear nurses here. Okay, so why hematologic disorders? Why hematologic disorders, Ma'am Tin? Okay, medyo hirap ako dito. This is not my favorite, no? Okay, so actually, why hematologic disorders? Okay, so these are the trending on NCLEX, right? So before we get started, let's explore why hematologic disorders, particularly your anemias, right? So these are trending in your NCLEX or an examination. So these topics are, often reflect a real world clinical scenario, just like today, especially for your next generation NCLEX. So it utilizes your clinical judgment, right? Okay, so it reflects a real world scenario that require critical thinking, and of course, it has something to do with what prioritization, especially when it comes to patient safety. Right, so we have here anemia. So actually, there's a lot. Okay, there are different types of your anemias, but for 30 minutes, we'll just tackle about 2 to 3 types of your anemia, which is very trending or hot topics. And yes, believe me, there's actually a 50 to 60% that it will appear on your actual NCLEX oral examination. So now let's start. Okay, so I cannot acknowledge you. I cannot see your Alright, so medyo hindi sanay si Ma'am Tin ng hindi masyadong nakikipag-usap. Alright, sige. So can you please type your location here? Okay, so from time to time, I will be checking our chat box. Okay, so let's start. So when we talk about your anemia, okay, it's very, very important to always go back into the basic because, when I was conducting a review or up until now, my dear nurses, no. So, my tip to my student is that do not memorize because for me, no, I hate memorizing. Okay, because once you memorize a certain concept and you tend to forget. Okay, a particular world, patay na. Mahirap yun. Okay, it's very, very important that you know, okay, the disease process. Okay, you need to, have an overview of a very simple understanding when it comes to the anatomy and physiology of the system or the organ involved. All right, so why? Because, for example, our topic is all about hematologic disorder, particularly the blood. Okay, so basically, what is a major function of our blood? Okay, so once you know the function, right? So you can enumerate what are the major cellular components. Okay, for our blood, you can now easily rule out, for example, your RBC. Okay, the main function of your RBC has something to do with what? Okay, it carries oxygen, right? So basically, that's it, right? So if you know the function, and if, of course, if this client or person, okay, was exposed to a certain, risk factor, and of course, to some causes, right? Okay, there will be an aberration, alteration, and of course, a disease process will follow, and that's what we call your pathophysiology. It's very important that on yourself, ikaw mismo sa sarili mo, ikaw ang nagde-define for you to, mas na-summarize mo. Right? Okay, so in your own words, that's very, very important, no? So what's happening, okay, on this certain condition, right? So if you can now rule out what's happening on certain condition, and then the disease process will follow, of course, okay, if there's any alteration or aberration, my dear nurses, okay, maglalabasan ang mga clinical manifestations, yes or no? The clinical manifestations will follow as well, right? So that is why I'm not into memorization, okay? It's very, very important that, okay, you know the flow, right? And if you know the clinical manifestations, especially the pathognomonic signs, all right, or what we call your classic sign, all right, we can easily, all right, rule out what is the specific or relevant management, okay, for this shift complaint, right? Okay, on your actual NCLEX art examination, it's a bit tricky, okay, but one tip that I would like to share, my dear nurses, no? Okay, it should be matchy-matchy. Okay, Ma'am Tin, what is that? It should be relevant. Okay, because ganun si NCLEX it should be relevant kung anong tanong yun ang sagot. Yes or no? Yes, okay. So when we talk about of your anemia, number one, okay, actually there's a lot. But yes, anemia lang ma-focus natin for today. Okay, so when we talk about of your anemia, this is a hot topic. Ma'am Teen, what specifically concept of anemia? Okay, so actually this is 70 to like 60 to 70%. Okay, we'll focus on the health teaching, not just in the anemia, my dear nurses, but okay, the whole NCLEX. It's more in health teaching, prioritization. It's more on, safety, all right, management. Okay, so you should know how to prioritize, all right, a specific case, all right. For example, there are four patients arrive into the emergency department. Who would you prioritize first? Okay, so yes, you will use your critical thinking, right? And sometimes it's a common sense. Okay, so when we talk about your anemia, my dear nurses, it's very, very easy. Okay, so anyone. Okay, so you can see a very simple pathophysiology here. So it says here that, okay, so the body has a low red blood cells, right? So basically our problem here is your red blood cells, okay? So basically it's low, right? So what will happen? Okay, it will lead to what? Decrease in the oxygen. Because we define, okay, one of the major function of your red blood cells or your erythrocyte, it has something to do with what? It carries oxygen. As simple as that. Do not complicate, right? Ayun natin ang komplikado eh. Okay. And of course, there will be a decrease in the oxygen delivery to our tissues. Of course, our vital organs will compensate, right? So of course, for example, there's a sudden drop in the oxygen level. Okay, yes, the vital organs will compensate. What are those? Of course, your brain, your heart, your lungs, your kidneys, no? Of course, if your heart and lungs will compensate, there will be, yes, a tachycardia in your tachypnea. That is why there is a high heart rate, okay, and high, okay, RR or respiratory rate. So just like your shock-like manifestations, right? So there's a decrease in the circulating blood volume, leading to hypotension. Okay, of course, sudden drop in the blood pressure, leading to the vital organs will compensate. That is why there is there's tachycardia and tachypnea. So same thing as your anemia, my dear nurses. Okay, this is just a simple pathophysiology. Okay, so these physiological responses are what? Crucial to recognize in both exam scenarios and real-life clinical setting because they help prioritize your nursing intervention. Okay, so actually for the most of the blood disorder, my dear nurses, okay, we have general interventions for this problems. Okay, so when we talk about of your anemia, it has something to do with what? It has something to do with just rest. Okay, more on provide adequate rest. Okay, and if there is any deficiency in the vitamin. Okay, so that's a rule in the medical surgical nursing. If there's any, for example, lacking of vitamin, so give foods that are rich in the certain, vitamin, for example, vitamin B12, all right, but there are some exemptions, right? For example, we will discuss later for the vitamin B12, but rule of the thumb, if there's any deficiency, in the vitamins, always start in, food, kung makukuha ng pagkain, then diet food, followed by the supplementation, right? So that's for your anemia. And we have different types of your anemia. We have here your IDA. Okay, IDA is the most common type of your anemia, okay? And what else? We also have here your megaloblastic anemia. Okay, what else? We have your pernicious anemia. Actually, for your pernicious anemia, this is under your megaloblastic anemia because the two known causes of your megaloblastic anemia is your folic acid deficiency and your vitamin B12 deficiency. right? So that's under megaloblastic anemia. And we also have here your sickle cell anemia. Okay, so let's give an overview now. Okay, for each type of your anemia. So when we talk about of your IDA, okay, let me just check our chat box. Okay, so we have here Sakina. Okay, hi Sakina from Bangladesh. I'm so sorry, I have to kailangan ko talagang ibaba para makita yung chat box. We also have here Abibatu from Ghana. Hello. Okay, so how about our dear nurses from the Philippines? Can you please type your provinces so that, of course, I can acknowledge you, no? Alright, ayan. So, para ma-shout out. Okay, so one thing that I would like to highlight in our iron deficiency anemia is that okay, this is just a simple pathophysiology. There's what we call a low iron here. Okay, so, okay, there's a low iron followed by, okay, there will be a low hemoglobin. All right, so, as I mentioned a while ago, this is the most common type of your anemia. So, basically, this condition occurs when the body has, okay, low iron levels. Okay, so which are essential for what? That is why it is essential for your hemoglobin synthesis. So there will be a low hemoglobin, my dear nurses, because without enough iron, hemoglobin level drops. Okay, so take note of that one ha. Ma'am Tin, magkakarugtong pala yan. Yes or no? And of course, your laboratory will reveal what? Okay, your laboratory will reveal yes, okay. Leading to what? Production of microcytic and hypochromic RBC. So when we talk about of your microcytic, meaning it's small RBC, meaning maliit. Alright, so when we talk about the hypochromic, chrome meaning it's the color. Okay, hypo, so meaning decrease in the color. So meaning, what is that? It's pale, yes or no? Yes. Okay, so we all know. Patients with anemia, okay, most of the patients with anemia, yes, they are pale. Alangan mo namang pulang-pula. Pale. Alright, my dear nurses. Okay. Okay, so what else? Okay, so let's write it down here. I will be using my chat box. Okay, so please bear with me, my dear nurses. No, my graphic pen is not working. I don't know why. Okay, take note of this one. I would like to highlight this. This is the most common type of your anemia. What else? What else, Tina? No? Okay, so for the causes, if NCLEX would ask you, okay, so there is what they call inadequate absorption or what? Excessive loss of iron, as I mentioned a while ago. Okay, so if NCLEX would ask you, what is the principal cause? Okay, in adults, okay? Principal cause in adults, okay, if NCLEX would ask you for the cause, okay, it's bleeding, my dear nurses. It's bleeding. What else? If NCLEX would ask you, okay, how about, okay, vitamin C, 10, okay? Yes, it's also one of the cause po. Okay, vitamin C increases iron, absorption, okay? And of course, patients who are, in a vegetarian diet. Anyone here who's in a vegetarian? Ma'am Tin, samyup kaya today. Vegetarian diet. Okay, so what else? Okay, so I would like to highlight, my dear nurses, okay, the signs and symptoms, because for the iron deficiency anemia, this is also present for other, okay, types of your anemia. So, minimum pinauulit lang. Okay, yes, repeated, my dear nurses. Okay, so meaning it's hypochromic. Of course, your patient is pale. Okay, so there is what we call pallor. Okay, particularly in the palmar. Can you see my camera? Yes, palmar. Okay, saan pa? Palpebral conjunctiva. Okay, during assessment. Okay, can you still recall, my dear nurses? Okay, the primary health care provider or the doctor or the physician. Okay, ayan. So, igaganon po yung inyong conjunctiva. No? So, titingnan kung maputla. I-check. Okay, so what else? Okay, in the nail beds as well. Right? Okay, so these patients will also, okay, what do you call this? Complain of what? Complain of, okay, yes, they are lethargic. Okay, lethargic. What else? Activity intolerance. Activity intolerance. We can also include what? Okay, patients with IDA. Okay, okay, they complain of exertional dyspnea or dyspnea, difficulty of, okay, shortness of breath, right? Because, okay, the oxygen is also affected because of decrease in the RBC. Okay, in general, okay, that's for your anemia. Okay, what else? How about 10 is the fatigability? Yes, that is why they are experiencing activity intolerance as well, right? So you can take a screenshot. Take a screenshot. Okay, good. Oh, I cannot see her chat. Okay, that's so sad. Okay, so we have here Ayan. So we have here Modi. Hello. Crystal from Laguna. We have here Josephine. Hi. Okay, so just skip on, ayan, mag-chat lang kayo. If you have any question, feel free to ask. I will try to answer at the end of our session, no, if we still have time. All right, so next, let's talk about some of the common diagnostic exam. Actually, if NCLEX would ask you, my dear nurses, no, okay, if NCLEX would ask you, okay, what is the most definitive, okay, exam, okay, for your IDA? Anyone? What is the most definitive if NCLEX would ask you? Okay. Then, is it okay, CBC? How about the others? What is your answer? Okay, so we have here Julie Ha. Okay, hi Julie from Saudi Arabia. Okay, so for our nurses, we're tuning in okay, Facebook Live. Okay, hi po. Ayan. What's the most definitive way, all right, to diagnose your anemia? Okay, if NCLEX would ask you, right? So for confirmatory or to diagnose anemia, so actually most of the blood disorder, if NCLEX would ask you, it's your bone marrow exam, all right? It's your bone marrow exam, bone marrow aspiration, okay? Bone marrow aspiration. Ano ba yan, Ma'am Tin? IDA lang, bone marrow aspiration agad-agad. O, diba? Okay, so we'll have a separate discussion of this one. Okay, but right now we're just, let's just give an overview for your ITA. Okay, so of course, laboratory findings will reveal the RBC. Okay, what are the characteristics of your RBC? Okay, your laboratory will reveal what? Okay, your RBCs are of course small. Okay, that is why they are microcytic. Microcytic. What else? My dear nurses, pale. Alright, that is why they are hypochromic. So sometimes, okay, if NCLEX will give you, a certain question or a case study, sometimes NCLEX will not mention the diagnosis of the patient. What type of anemia? Rather, okay, NCLEX will just, give the pathognomonic sign, the unique sign, the classic sign, or the perfect description for this condition. Alright, so sometimes the NCLEX will use a patient arrived in the emergency department complaining of, exertional dyspnea, difficulty breathing, etc., etc., and the laboratory reveal that the RBC are small and pale. What is that? And NCLEX is asking about the health teaching. Alright? What is the perfect health teaching? If you didn't know the diagnosis, so meaning Ma'am Tin, as registered nurse, we must have a solid understanding about the assessment, particularly what? I would like you to focus on the pathognomonic sign, ha? Yes or no? Yes. Ha? Kaintindihan? Kaya today? Yes, you can do it. Okay. So what else? The laboratory, aside from the RBCs or small and pale, what else? Okay, your laboratory will reveal, okay, decrease in hemoglobin, as we mentioned a while ago, because of the low iron. What else? Decrease in the hematocrit as well. Okay, decrease in, the serum iron. Okay, so next. Okay, yes, you can take a screenshot. Okay, so for the management, okay, hot topic on your NCLEX or an examination, of course, okay, rule of the thumb in the medical surgical nursing. Okay, so listen, my dear nurses, this is not just specific to anemia. Okay, so this is the rule for the diet when it comes to the medical surgical nursing. If there's a deficiency in any vitamin, my dear nurses, ano, so most but not all, ha? Okay, so if Ma'am Tin mentioned, okay, most, ibig sabihin, halos lahat. Alright? Okay, so if there's a deficiency, of course, kulang, bigyan mo. Right? Of course, you will start introducing foods that are rich in, for example, all right, foods that are rich in iron. Okay, of course, you should know what are the foods that are rich in iron. Okay, what are those, my dear nurses? Okay, so aside from that, our general management for your anemia, in any type of your anemia, very important to what? Provide adequate rest. Yan lang yun. Provide adequate rest. Okay, adequate rest is something to do with, yes, adequate rest, diba? Okay, tapos, frequent rest period. Okay, so meaning, Ma'am Tin, we need to use our critical thinking because NCLEX might paraphrase that, yes or no. Yes, as a registered nurse, you should not rely, okay, word per word. Use your critical thinking or common sense. Okay, as what I've mentioned before during our sessions here in AMN Healthcare. Okay, for you to pass your NCLEX RN exam, okay, it must be two things. All right. What are those, my dear nurses? Okay, if you can still recall, okay, Ma'am Tin, okay, we need to, have a deeper understanding when it comes to the concept. Yun lang. Okay. For you to pass, my dear nurses, it's not about the concept. Okay, of course, you must have, okay, you need to master, okay, our foundation, which is, of course, what we're studying right now, right? Okay, so, the categories, the subcategories, okay, that you will expect to be asked on your actual NCLEX RN examination. But apart from those concepts, okay, my dear nurses, the second one is that you need to focus on what? Okay, number two, this one is the most important thing. So for me, this is the superpower. What is this? Okay, this is your test-taking skill. And this test-taking skill is a skill. Kasanayan ito. Alright? Kumbaga, ito po ay, hinahasa ang sarili po natin. Ito po ay pambihirang kakayanan po. My dear nurses, no? There are some students who are, very good when it comes to, discussing, okay, intensive, comprehensive pathophysiology. But when it comes to answering NCLEX question, okay, so, minsan inaaway pa ang tanong. Alright, why? Because they are lacking of what? Test-taking strategy, diba? Testing skill. It's a skill Okay, it's different, okay? And we have a separate discussion of that, how to improve your testing skills, okay? And you need to focus, okay? If you're lacking, okay, of that specific area, my dear nurses, no, okay, you should be aware. Because if you are not aware, you cannot analyze, saan ba ako nagkulang before? Bakit ba ako nag-fail before? Di ba tatanungin mo yung sarili mo? Okay? So, be open. Kailangan assertive ka. Like, kailangan open cup ka, di ba? Open-minded, empty cup. Okay, my dear nurses. Okay? So, dapat aware ka kung san ka area kailangan talagang mag-focus. And we are here to help you. Okay? Next, ang daming sinabi ni Ma'am Tina. Dalawang bagay ha, maraming takeaway. 1 minute na lang. Hanggang IDA lang pala tayo today. Continuation na lang. Adequate. Okay, adequate rest. Okay, so next. Okay, I would like to highlight this one because this one is a hot topic, my dear nurses. Okay, what are the foods that are rich in iron? What are the foods that are rich in iron? If NCLEX would ask you for the select all that apply, okay, kindly key in your answers. Okay, I will just check your chat box. Okay, anyone here? What are the foods that are rich in iron? So we have your, anyone? Okay, diba, your organ meats, my dear nurses. Okay, what else? What else? Example of this organ is your liver. Okay, what else? Okay, meats, dark green leafy vegetables, dark green, okay, leafy vegetables. Okay, so what else? Okay, rich in calcium at the same time rich in iron. Okay, so what else? Okay, dark dried fruits. Okay, dark dried fruits. Okay, dried fruits. Okay, keywords. Okay, di ba puro mga dried foods, diba? Ayan, mga rich in iron. Ayan, mga pasas, raisins. Okay, what else? Previous NCLEX question. Okay, one of the option is your egg. Okay, particularly the egg yolk. Sometimes egg or egg yolk. Okay, favorite of your NCLEX. What else? We can also include tofu. What else? Your shellfish. Your shellfish, my dear nurses, okay? Of course, Ma'am Tin mentioned that, yes, adequate rest. Of course, that's our management for your anemia, and then foods. If diet is not enough, okay, then as prescribed, okay, the HCP will order what iron supplementation, and we have okay special nursing consideration when it comes to your iron supplementation, my dear nurses. Supplementation, okay. My dear nurses, take it with what? Take it with orange juice. Okay, so anything associated, okay, with orange juice or vitamin C, pares yan. Okay, so anything that is associated with vitamin C, okay, it's okay. Ayan, for better absorption. So meaning this one is better absorbed on empty stomach. Okay, so best absorb on empty stomach. All right, on empty stomach. Okay, so what else? All right, so of course before meals or in between meals. All right, so what else? So what are the foods that are okay, the foods to avoid, because okay, these foods might decrease okay the absorption. All right, so what are this? So meaning avoid foods that are for example, okay, irritants, my dear nurses. Example, your coffee. Okay, so what else? The dairy products. Okay, dairy products. What else? Dairy products. Okay, how about milk? Yes, we will also avoid the milk. Right? Okay, and the use of your antacids. So basically, these are okay the foods okay that decreases the absorption. Okay, it decreases the absorption of iron, right? And of course, very very important. Okay, to take note of the side effect of this iron. Okay, so when it comes to your pharmacology, my dear nurses, we have the rule ha. Huy, favorite of your NCLEX pharmacology. Ma'am Tin, that's my weakness. Kaya today. Kaya talaga today. Okay, so when we talk about of side effects, so these are expected effects. So if NCLEX would ask you, okay, for example, your patient complained of, for example, constipation and dark stool. Okay, as registered nurse, okay, what are you going to do? Matataranta ka ba? Okay, A, are you going to document and monitor your patient? Okay, letter B, are you going to call or report, okay, to HCP? Hoy, expected. Okay, so meaning, okay, constipation, okay, and dark stool are the side effects of your okay, iron, diba? Yes, so meaning, when we talk about the expected, okay, just document. Alright, so Ma'am Tin, when are we going to call for the HCP? When are we going to report? If there's any, okay, worsening of the condition, what else? Okay, adverse effect, toxic effect, dun tayo magre-report, ha? Dapat may gawin ka muna sarili mo. Ganun ha. Alright, so next, we also have here, okay, our preparation for our iron, okay? So your preparation, your iron can be in a liquid form, okay, or in the liquid preparation, okay? And what is our health teaching if your iron is in liquid form? Okay, so instruct your patient or instruct your client to use what? Okay, to use ano pa? Straw, my dear nurses, right? Okay, to prevent what? To prevent from, okay, to prevent staining. Staining of the teeth, no? Oh, may student asked me, Ma'am Tin, ba't ang white ng teeth mo? Hindi kasi ako nag-iron. Chareng. May nag-PM pa talaga sa akin. Ma'am Tin, ang ganda ng teeth mo. Totoo ba yan? Here is a teeth ni Ma'am Tin. Okay, so you sure to prevent staining of the teeth, ha? So how about if the iron is in IM? Okay, IM injection. Okay, so what is our Okay, instructions here. For example, you are, observing or tumutulong ka doon sa new nurse, no? Okay, ayan. So, bago pa lang, no? So, what is our instructions? If the iron is IM injection, yes, it's your Z track method, no? It's your Z track method, my dear nurses. All right, so you can take a screenshot. You can take a screenshot. All right, so talaga kinukulang kay Ma'am Tina isang topic. All right, so it's already 9:36. All right, so my dear nurses, okay, you can take a screenshot. Okay, so I hope marami tayong natutunan about your iron deficiency anemia. Okay, so on our next meeting, okay, we will talk about your sickle cell anemia, another hot topic on your NCLEX RN examination. Because let me just check your our chat box here. Okay, so did I missed? Okay, uh, shout out. We have here Diane. Hello, Diane. We also have here okay, Myris. Okay, Myris says green vegetable. All right, so yeah, medyo kulang ang ating time, but of course, I know marami tayong natutunan, my dear nurses. Of course, I would like to thank you guys. Okay, thank you everyone for joining me today. Okay, I know it's very short, no? Okay, it's a very short time to cover such a broad and important topic. Okay, so I thought I can discuss the megaloblastic and the sickle cell. No? Daming kwento ni Ma'am Tin, but I hope this session gave you valuable insights into hematologic disorders, especially, okay, the anemias, no, your iron deficiency anemia, and how they relate, okay, and how this IDA relate to the NCLEX RN examination. Okay, so if you have any question, feel free to reach out, my dear nurses. So again, this is Teen and Daya. Thank you so much and have a great day, my dear nurses. Bye-bye. Hi, Dayan. Nakapasada si Dayan. Bye-bye. Good luck sa mga mag-exam.